I'm Victoria, and today we're going to be discussing incontinence. So, incontinence is caused when there is either damage or dysfunction to either the external or the internal sphincter. We're going to be discussing bladder incontinence specifically, so it's going to be urethral sphincters that are affected by this. And it causes disruptions in either urine storage or urine elimination. The four different types, there's stress incontinence, which is more common in women, and will be like light leakage when like coughing, sneezing, laughing. Sometimes it can happen when you pick up heavy objects. Urge incontinence is like large amounts of urine leak at just random unexpected times, typically during sleep. Overflow is small leakage due to your bladder being too full, so you can't empty all the way, so it causes incontinence in that way. And then there's functional, which is due to like disability, some kind of cognitive issue, or there's like obstacles or just the inability to move around to get to a bathroom. So when we're doing our assessment on somebody that has incontinence for any reason, we're going to do an abdominal assessment, like a full abdominal assessment. In females, we're also going to check for prolapse, just to see if that's part of the issue there. We're going to run a urinalysis to see if they have a urinary tract infection, because that can sometimes, severe infections can lead to incontinence. We're going to do a bladder scan to see how much they're retaining, to check for the functional incontinence. Or overflow incontinence, not functional. Because if they're retaining large amounts, but they're still incontinent, it's because they're not able to eliminate all the way it's causing the incontinence. We're going to do CTs of the kidneys and the ureters just to check all of that. And we're also going to do EMGs of the pelvic muscles to see if it's a muscle dysfunction that's causing the incontinence as well. So, what we're going to teach our patient when they have urinary incontinence, if it's like a stress incontinence, we're going to teach them different pelvic muscle exercises to strengthen the muscles to reduce that incontinence. There's some nutritional aspects, typically like increased proteins to help build the muscle back. You can do electrical stimulation therapies to help also retrain those muscles if it's just like a weakening. And worst case scenarios, we'll do surgery to repair the muscles. For functional, we can do catheters for like long-term treatments. If you have like patients that are admitted for like really severe injuries where they're not allowed to move, they'll typically put in catheters for skin integrity. But you also want to make sure with catheters that you're keeping them well cleaned, because you don't want to cause a urinary tract infection, which can just cause more problems down the road. So we're also going to teach them like a schedule. So try to train them to hit a schedule to kind of just progress, especially for urge incontinence. Get them scheduled, give them a plan so they kind of have a routine, which will reduce their incontinence. With the urinary tract infections, with the catheters, really severe urinary tract infections can cause something called cystitis, which is a really bad inflammation of the bladder. So that's something we really need to watch out for if we have indwelling catheters with our patients. So those are what we're going to watch for with our urinary incontinence.